Care across the continuum. Most older adults are going to prefer to remain in their own home rather than to relocate. Home is defined as a basic shelter that is secure and where a person belongs, and it has to provide the highest possible level of independence, function, safety, and comfort. Elder-friendly communities are areas that provide support to the older adult and encourage the older adult to live where he or she desires. The community will be a good neighbor to the older adult. Now, there's a variety of areas where the older adult can receive care. By looking at the components of the older adult-friendly community, the older adult can select the area that will optimize the needs of the older adult. So look at your diagram here on top. Depending on how independent they are or how much assistance is required, can help the older adult determine which area is going to be the best one for them to live in. There's different models of housing for older adults, and we start off talking about shared housing. Shared housing can be done with siblings, adult children, or other older adults. There may be a separate apartment that has been set up within a home, and this can be very economical for an older adult who has a limited income. There's population-specific communities. They can provide specific services for older adults, such as the developmentally challenged or those adults that have mental disabilities or alcoholics. Some population-specific communities may support a particular interest, such as golf or fishing, etc. Senior retirement communities provide combinations of apartments, activities, optional services such as meals, housekeeping, restaurants, and different recreation opportunities. It does make independent living possible with the least amount of effort on the part of the older adult. Interventions for the older adult to remain in the home will include adequate transportation, home modification, such as do they need to have things situated all on one level of the home to prevent the older adult from having to go up and down stairs? Do they have grab bars, shower chairs, etc.? Excuse me. They also require barrier-free housing, so doors that are wider and hallways that are at least 36 inches wide to accommodate equipment that may be required for the older adult. Bathrooms should be on the first level, outlets at wheelchair level, and reinforced walls that will allow the placement of support bars. Adult daycare services will provide respite services for caregivers. They provide supervised care during the day so the primary caregiver can work or maybe even run errands. It can be a supplement to in-home care. Residential care facilities is a broad term for a wide range of non-medical, community-based residential homes. It includes assisted living facilities, retirement homes, and rest homes. These facilities are designed to be more home-like. Assisted living facilities are for the older adult that does not require 24-hour per day skilled nursing care. The older adult usually requires some assistance with only just a couple of their ADLs. These facilities do provide some support services but do allow for independence and privacy. And a lot of these facilities also have a dementia-specific unit available. Continuing care retirement communities are life care community that provides access to different levels of care for a community member's lifetime, which decreases transition stressors when the older adult has to move from one level of care to the other. Different levels of care are provided within that one community. And then there's the program for all-inclusive care for the elderly, which provides for the older adult's needs while allowing the older adult to live independently. Acute care settings are going to be found mainly in the hospital type setting. Hospitals, unfortunately, can be dangerous places for older adults. 34% of older adults who have to receive acute care within the hospital facility will experience a functional decline, and 29 to 38% will experience complications. Nursing homes, the number of beds are decreasing because the use of residential care facilities are increasing. Nursing homes will offer restorative and rehabilitative services, but they are very highly regulated by state and federal governments. Skilled care facilities are also known as subacute facilities. They provide restorative and rehabilitative services also. Medicare reimbursement will only be for a specific time frame. So in other words, if an older adult is requiring additional work on physical therapy after a joint replacement, they're not able to get back to their style of independent living at home by themselves, they still need some help. Their strength isn't there, etc. The skilled care reimbursement will only be for, say, 2 weeks or a month. I think I'm not real familiar with the length of time, but for some reason 30 days is sticking in my mind before they have to receive reauthorization, etc. But they can also receive like intravenous therapy, etc. Older adults will enter the facility until they are able to function independently. There's numerous organizations and governmental entities out there to help ensure and improve the quality of care for older adults residing in nursing homes. Nursing homes are transitioning to a more home-like setting in which the older adult can decide when to get up, when to take their bath, when they go to bed, etc. This is also known as person-centered care. Transitional care can create gaps in the care, usually from a lack of communication or a failure to communicate somewhere within this transitional period. These gaps and transitional care can result in status decline, and transitional care models may decrease these gaps and improve outcomes. Relocation stress is a major issue that does not receive as much attention as it should. Individuals must have some control over his or her environment. The client has to have appropriate time to be able to prepare for his or her new situation. The nurse will closely assess and monitor the client until they feel that the client has made that transition. One way to help decrease relocation stress is to have familiar and treasured items with the client. So we need to keep in mind as we are caring for older adults that have moved from their lifetime home, etc., that if this is not their choice, that relocation stress can be a major issue. They withdraw into themselves. They don't try and get involved in community activities within the facility or outside the facility. They really don't want to have anything to do with anyone or anything else. Their eating habits change, and you may even see signs of depression.